All right, so today's talk is called Strategies for Supporting a Young Person with Early Psychosis, and this will be part one of a three-part series. As I mentioned, this is brought to you by the STEP Learning Collaborative and Mind Map with support of DEMIS and DCF, and I have no conflicts of interest to disclose. So a bit of an outline of what we'll be covering today. We will be going over a brief background on early psychosis. We want to make sure that anyone who's new today and joining will be able to kind of understand some of the basics. And then we'll be really focusing on the role and importance of families or other caregivers. And when I say families, I really mean that broadly. I don't mean that you have to necessarily be biologically related to someone, but in kind of a caregiving or support person role. And then the bulk of today's session will really be focused on general strategies related to communication and interaction styles for family members in supporting their young person. Cover some CBT-informed and adapted strategies such as focusing on the relationship, engaging in curious questioning, the really important skill of validation. I'll talk about this concept of the writing reflex, and then I'll also make sure that folks are aware of what we're trying to do statewide to better support young people and families experiencing early psychosis and future resources and training opportunities that you can attend. So to get started, we will cover some background on psychosis. So what is psychosis? I imagine most people in this room have a pretty good idea, but when I say psychosis, I really mean it as an umbrella term. It's not necessarily a diagnosis in itself. Psychosis is a medical syndrome that can be characterized by a cluster of changes in thinking, feeling, and behavior. And what's characteristic of this is during an episode or experience of psychosis, individuals can really struggle to differentiate what's real from what's not real, and may even become to strongly hold on to false explanations for their experiences. So psychosis is more common than one might think. It impacts approximately 100,000 youth and young adults every year. Every 3 in 100 people will experience psychosis in their lifetime, with 1 in 100 of those folks developing schizophrenia spectrum disorder. And we estimate that there'll be approximately 500 new incidences of schizophrenia in the state of Connecticut every year. And so 3 times that many folks experiencing some type of psychosis. You know, we talk a lot about early psychosis or first episode psychosis. And so just to share what we mean by that, when I say first episode psychosis, I'm simply referring to the first time that someone experiences psychotic symptoms or an episode of psychosis. And so this doesn't necessarily have to be the first moment, day, or week. The STEP Learning Collaborative, we think about this in terms of approximately the first 3 years of someone experiencing these symptoms. Different places, define it in different ways, sometimes a shorter duration, sometimes up to 5 years. But we do know that the kind of first 5 years since onset of these symptoms are what's known as a kind of a critical period and a time when interventions can be most helpful and most robust in terms of impacting long-term outcomes. So what causes psychosis? It's complex. There's not one single thing. There's not a blood test that we can do to say, yes, I have psychosis or I don't. It's a, complex interaction of biology, genetic predisposition, and environmental factors and stressors. And so it's thought to have several causes, and careful assessment is required to distinguish between episodes of psychosis that might be caused by medical illnesses, such as an infection or epilepsy, psychosis that's due to substance use, such as acute intoxication on cocaine, other stimulants, or cannabis. Once those other causes are considered and ruled out, the most likely explanation for an individual experienced psychosis in a young adult is the emergence of a mental illness, such as a schizophrenia spectrum disorder or other mental illness like a bipolar disorder or depression with psychotic features. So we'll quickly go through some of the common signs and symptoms of psychosis so we know kind of what we're talking about when we think about some of these specific strategies that families might use to support their young people. Perhaps the most recognizable symptoms and experiences of psychosis are what we call positive symptoms. And so positive meaning in addition to, so some kind of extra activity that wasn't typically occurring before. And so this is an addition or a distortion of an individual's typical functioning, perception, or behavior. And so these are things like hallucinatory experiences. So that could be visual, auditory, olfactory, even taste, touch. All of the senses can be impacted. delusions or kind of fixed false beliefs, which could range from something that's very plausible and realistic, such as, I'm feeling convinced that my partner is cheating on me or that my family doesn't like me, to something that might be more bizarre or implausible, such as, my parents have been switched with aliens, or I've got a chip implanted in my head. And paranoia can be a type of persecutory delusion, such as when we feel like someone is out to get us with a malicious intent. Folks might also experience disorganized communication. Their typical language may become tangential, circumstantial, or even when really severe, the fact that it can't even be understood, just kind of a amalgamation of words. And sometimes we might refer to it as word salad when the disorganized speech is so severe that things aren't really making sense and speech isn't able to be comprehended by another. It's important to recognize that with any of these symptoms, folks might experience limited insight. And so that's what I was referring to with that difficulty telling what's real and what's not real. Limited insight being that these experiences might feel very real to an individual experiencing psychosis. It feels as true as, their name or some other fact that one might have a hard time, disputing. There are also negative symptoms. So this is referred to as kind of a reduction or loss in an individual's typical functioning. This might look like decreased motivation, less energy, changes in speech, like less speech output. You might notice behaviorally social withdrawal, a flatness in an affect or emotional expression. From a caregiver's perspective, you might also notice this as, your young person might be paying less attention to their hygiene or might experience a dramatic decline in their functioning, whether that's their work functioning or school functioning. And so although those are some of the main categories of symptoms, some folks experiencing schizophrenia will also experience cognitive symptoms. Changes in their executive functioning might decline, more difficulty paying attention, working memory changes, something called kind of thought blocking, and even a reduced ability to kind of think abstractly. So not all of these symptoms occur for every person that is experiencing psychosis, but all of these kind of are possible. And then even in a primary psychotic disorder like schizophrenia, folks might be surprised to know that their mood fluctuations are also going to be expected, even if it's not something that's a bipolar disorder or a depression, but that can be normal to notice fluctuations in terms of anxiety or depression and even suicidal ideation in folks with a primary psychotic illness like schizophrenia. Now that we've kind of quickly covered some of that basic background on psychosis, I really wanted to shift to the focus of this session, which is the role of families, and then get into some strategies to support families. So I know that we've got families, in many different roles. Young people are often, in fact, 85%, some studies show, of folks with this population are living at home and or relying on family members for various forms of support. And we recognize that, in our audience here today and other folks that will be viewing this content, that families can be in various different places, right? You might be supporting someone who's actively engaged in treatment, whether it be at STEP or another agency across the state. You might be someone who's desperately trying to connect or encourage your young person to go to treatment. You might be, unsure of what's going on diagnostically, not sure if psychosis fits your loved one, and trying to, learn a little bit more to understand if that what makes sense and if you should pursue treatment for this. Different folks might be supporting someone frequently in the hospital, living in a residential facility or other type of institution. And we know that there are some, families or caregivers that might be separated from their young person, either by their choice or your choice, or, some necessary boundaries. And so we recognize that folks are coming from a variety of places. And I hope that wherever you're coming from, that you can glean at least something from today's workshop. I want folks to know that, families can have such an important impact on recovery. Although there's so much about the development of schizophrenia that we can't control and it's not anyone's fault, families can positively impact recovery through a variety of ways. When families are involved, young people have better access to care. Often kind of families advocating and supporting the young person, whether it be logistically transporting them there, reminding them of important appointments, but families are crucial. Research has shown that when families are involved, their young people have better outcomes in treatment in a variety of ways. Clients seem to have better outcomes when families are involved in the treatment process and family treatment is a part of it than just individual treatment alone. Long-term family engagement reduces relapse rates of symptoms of psychosis up to 50% more than medication alone. When families are involved in a supportive way, there's fewer hospital admissions, shorter inpatient stays, and less intensive interventions when those admissions are occurring. And also we see an overall improvement in quality of life for the young person and reduced substance use. Although we know that there can be so many challenges that might come with supporting a young person experiencing psychosis. And I hope there are some positive experiences too that we'll talk about throughout some of our next sessions. But just looking at this and recognizing the positive impact that your involvement can have. So getting into some strategies. As I've said, we recognize the challenge that it can be difficult at times. Not everyone's the same, but of supporting a young person experiencing psychosis, particularly when an individual might not be interested in treatment or has minimal insight, or when family members are getting pulled in so many different directions, caregiving for other children or elderly parents or just work. There's so many pressures on families and caregivers. But we want to inform you that there are some strategies and things that you can do to hopefully empower you in supporting your young person's recovery and hopefully also reducing some of the stress in the home for everyone. These are just some general strategies, and then we'll get much more specific. As I've already mentioned, in some ways, families can help their loved one access and engage in treatment, right? We can have practical roles that we play, helping them get there, helping them fill out paperwork to, sign up for a clinic or, remind them of appointments, get engaged. Family members can encourage medication decisions. No, they don't have the power to force an individual to take a medication in an outpatient setting in Connecticut, but can help your young person make informed decisions and encourage them. A really key thing that we'll talk about a bit more in our next session is learning to recognize early warning signs and symptoms for your young person. This can be so key, and family members play such a key part and role as part of the overall kind of treatment team. Learning what it is, what it looks like when your young person maybe is starting to get stressed or have some breakthrough symptoms, and then, working with your treatment team or understanding what are some of the coping strategies to help manage that stress and support your young person in getting that level of stress down so that it doesn't result in a hospitalization or negative kind of behavioral outcomes can be key. And again, not everything's within our control, but you should feel empowered that, there are signs that we can pay attention to, and often families know your young people way better than we do as providers, and you're really the experts in kind of recognizing the subtle changes in your young person, and bringing that to light can be really helpful in relapse prevention or detecting early warning signs. You've also got the ability to model and encourage healthy habits in the home, whether those are, basic things like eating healthily, getting about that 8 hours of sleep, having, exercising, getting out for walks, things like that, engaging in healthy relationships. Those are things that you can absolutely kind of model and encourage. A big one, families can play a key role in discouraging substance use. We work with a lot of families where, it can be commonplace for folks to be regularly using cannabis or even distributing it, but especially for our population of folks experiencing psychosis, as you may have learned from our previous talk about the impacts of cannabis on psychosis, that it's not a good mix. Cannabis can really exacerbate existing symptoms or even put someone at risk for an increased risk of developing psychosis. So if you're, a family member who's using that in the home and not having any negative effects, recognizing that, the modeling of that to your young person or easy access that they might have, or, just being aware that, for folks with this experience, this is not a good mix, and trying to discourage that behavior, which I know is easier said than done. Can try to decrease the overall stress in the home. That can look a lot of different ways, whether that's trying to keep the emotional climate cool with minimizing kind of loud arguments and sensory stimulating things, keeping expectations manageable or even lowering them temporarily, whether that's chores or different things that maybe you previously expected of your young person, but then since the onset of this psychosis, maybe they've been less able to engage in some of that, and to, at times temporarily lower those expectations. And that doesn't mean that you're enabling your young person to be lazy or anything like that. It's meeting them where they're at. It's recognizing the potential change and helping kind of decrease some of the stress. And of course, all of this is individualized, but I, understandably hear a lot of parents and loved ones say, I don't want them to give up, or I don't want to stop having expectations for my young person and they never strive for anything. And that's absolutely not what we're endorsing. I always tell people to try to lower expectations, but maintain aspirations. We're taking things a day at a time, a couple weeks at a time, and we're hoping to build on it as we progress throughout recovery. And it's important to celebrate progress for your young person and try not to, compare your young person to where they were before the onset of the psychosis. I mean, that's impossible, right? It's what we do, but recognizing okay, I'm comparing where you're at this week compared to last week, and let's celebrate those strides that both you made as an individual. Okay, wow, you got out, you applied for a job this week, or you took your medication consistently without having to be reminded. We decreased our arguments as a family, right? There's a lot of different ways to celebrate progress, and it's important to do that. And holding on to hope. We certainly try to do that as providers because we see every day, people living meaningful lives and engaging meaningfully in their community and having fulfilling relationships. So holding on to hope for recovery, especially if your young person is feeling like, oh, I'm not how I used to be, or things like that. And we'll talk a little bit too about how to validate where someone's at. But I think for this one specifically, it's, you can hold on to the hope that things will continue to improve. And I'll show later our website, but we've got downloadable family guidelines. So what we know about families' roles, we know that people experiencing psychosis might be particularly sensitive to the following, particularly sensitive to warmth. Folks tend to do well with structure and support, but also kind of giving space and letting, being able to recover at their own pace. So warmth meaning, recognizing the good, celebrating that progress, having a kind tone, trying to minimize critical comments and negative interactions. We also know that this idea of what's sometimes called over-involvement or emotional over-involvement can sometimes be too much for people. And although very well-intentioned, right? Sometimes as a caregiver, we might be dealing with some of our own anxiety or trying to take control of a situation that feels so uncontrollable. So we try to get right in there and do everything, and we're trying to be on top of everything, which again is great and adaptive in many ways, but making sure that we're kind of checking ourselves and okay, hang on, am I being a little too intrusive or doing too much? Can I check in with my young person about how they're perceiving my involvement? Hey, when I ask you all these questions about your appointment or remind you all these things, what's that like for you? Does that feel helpful, or does that feel like that might be too much? And there's different ways to kind of talk about it. And these are kind of general statements. There's different situations for every family, but research does support some of these overall constructs. And also we know that when someone's experiencing active psychosis, especially having some, thought disorder, that complex or unclear communication might be hard to process and can make things more challenging for the person. So especially if someone's in kind of a more acute phase of their recovery where there's a lot of active symptoms going on, we want to keep things simple, make clear asks of them, try not to be kind of circumstantial, and just to kind of get to the point so that it's easier to comprehend. Now getting on with some more strategies. And the next couple that I'm going to talk to you about are ones that are informed by CBT, or cognitive behavioral therapy in general, and cognitive behavioral therapy for psychosis, which is one of the most evidence-based treatments that we like to use therapeutically to support young people experiencing psychosis. And so there's been a lot of work, some of it out of the University of Washington and folks at Stanford, in what's called the kind of Psychosis Reach program. They've really tried to adapt some of these key concepts that we use as therapists to make them accessible for family members to use in their interactions. And so just emphasizing that families, again, are so important. And this shouldn't replace, formal treatment or things like that. We're not trying to say like we're teaching you CBT for psychosis and we expect you to be social workers or psychologists, but more so thinking about it as skills to kind of supplement rather than replace formal therapy. Just like how someone with diabetes, a parent would learn how to check blood sugars or operate an insulin pump, the same way that these strategies we hope will kind of support folks in kind of just supporting their young person while hopefully they're also engaging in other supportive resources. So with all that being said, I want to talk about the first one and a really foundational strategy of focusing on your relationship. Focusing on your relationship. We, as therapists, we think about this piece so much as we call it the therapeutic alliance or the relationship. And similarly, family members should think about this too. We often can't do much from a position of conflict. And I don't want that to feel, disheartening to folks maybe in this room who are like, I am at odds with my young person right now. We're just butting heads. I feel so far from where we were. That's okay, right? We can take slow steps to kind of rebuild and find some common ground. And so, although I mentioned how this is such an essential piece that we focus on as therapists, family members have so much more rapport already with their young person, but you also have so much more history. And that's a lot of history to work through sometimes, but it can be kind of overcome and progress can be made. I want you to think about things that we call befriending skills, or it is exactly how it sounds. What would I try to do to almost like make a friend, to be friendly to an acquaintance or friend in my life? I'd want to be positive, supportive of them, try to kind of foster a companionship. And all of these things might help start to change the dynamic and strengthen the relationship. And so this might practically look like highlighting strengths of your young person. Wow, whatever it might be for them, and make sure that these are genuine kind of compliments or noticing. You want to engage in shared interests with them. Not everything has to be a conversation about treatment or their psychosis. Individuals experiencing psychosis are so much more than that part of their experience, although at times, and especially during the first episode, right, it can feel just like the only thing and the thing that is consuming the whole family. But remembering that, your young person and you're also people with other experiences and other aspects of your identity. And so engaging in those with your young person, right? Talking about positive memories. There is some research about kind of this kind of positive reminiscing, whether that's thinking back to, it could be, something earlier in childhood. Wow, like remember when we got our first dog, or we went on that vacation and how fun that was, or how silly that was when we spilled that thing or we made that mistake. All of these things can kind of help foster and bring some positive emotion to the relationships and kind of can ultimately build the foundation for kind of next steps to kind of understanding a little bit more about what's going on with them and maybe even moving towards change in some ways. But really here, we're just looking for moments of connection. A lot of times, again, work with families and parents who are understandably so overwhelmed, in crisis. They're saying, no, like we gotta talk about meds, or we have to talk about all of these things. They haven't got a job. They need to do this. And yes, I feel that urgency, and those things are important and shouldn't be ignored. But I want you to know that this is important too. And it's not wasted. It's not you ignoring the problem. It's just really a foundational part of again, focusing on your relationship, building a foundation for a long-term recovery and a positive relationship with your young person. And also with this, working on, developing shared goals, kind of coming to some common ground. And maybe that starts to look a little bit treatment oriented. Okay, so like we both agree, wow, you were in the hospital. That really wasn't great. That was really scary for you, and it was scary for me, and I didn't know what was going on, or, we don't want to do that again if we don't have to. And okay, so we both agree that we want you to be able to stay out of the hospital, or so that you can, whatever it is, stay in school, stay connected to your relationships, keep your job, not have to go on medical leave, whatever it is. So kind of finding a way to ally with your young person and find some shared goals is key. So, and not that there's necessarily an order to all of these things. I think all of these skills kind of can happen simultaneously. But the next one I want to talk about Again, another really key aspect of a cognitive behavioral therapy approach, and so that can be easily adapted for family members, is engaging in curious questioning. If we're talking to our young person, it's important to be curious and non-judgmental. Okay, we know that you've known your young person their whole lives, most likely, right? So, but I want you to try to forget that you know so much about them almost, and just be curious. Try not to make any assumptions, all right? We're asking, remember that we know that highly critical comments and things like that are particularly not helpful for young people experiencing psychosis, or really any of us. The way that we can be curious is asking open-ended questions, showing genuine interest, making eye contact if they're comfortable with that. If someone's feeling a little paranoid or uncomfortable, then respect where they're at. You can sit side by side. You can talk while you're on a walk. Sometimes that's more comfortable for people than looking right at each other or talking while you're doing an activity. But keeping that curiosity open. We want to be curious and we want to listen. Okay, so when we ask those questions, we don't already want to be thinking ahead of what we're going to say or how we're going to rebut this or tell them they're wrong or offer our suggestion. Really, really want to have the goal of kind of hearing what your young person has to say. And they'll feel that too, that you're genuinely interested. And so this is where those active listening skills come in, where we're going to summarize and reflect what we've heard. You can just on the next a couple slides from now, I'll talk about different types of reflections, but could just be stating back to someone, okay, I heard you say that school's really hard right now. You can always check in. Am I getting that right? Did I hear you right? Just like I said too, thinking about sometimes that over-involvement or trying to respect the pace that a young person's at. Ask permission. We do this a lot as therapists too, but is it okay that I'm asking these questions? How is this going for you, right? That helps the person feel in control, right? And again, that's helpful for anyone. We like to feel confident and in control, not judged, but especially a young person, an adolescent, they like to feel autonomy. There's so much that maybe feels not in their control, especially right if someone has experienced an involuntary hospitalization or strongly encouraged to go to treatment, or there's just so many things that might feel out of control. So trying to find ways to kind of give that control back in appropriate ways, and certainly in the kind of emotional intimacy in conversations is one way. And so if someone says like, actually, no, like this is so overwhelming to talk about, like, okay, thanks for letting me know. Like, let's take a pause. Maybe we can come back to this later, but like, let's step away from this. And you might not want to do that right now in that moment. You're like, they're finally talking to me about something really important. But respecting where someone's at will really help you down the line. I tell all kind of clinicians that I work with about this, and family members, especially if someone's kind of acutely experiencing psychosis and they haven't been challenging their beliefs in the past, I would say don't challenge or collude with the experience of psychosis. So by that, I mean, don't say like, someone's saying, I'm being followed. That's not real. Like, you're completely wrong. That's so silly. That's a delusion. I would not say that unless I had lots of kind of rapport and evidence where like we had talked about this before and they wanted me to kind of point that out when they get in this state. But most of the time, we're not going to be overtly challenging experiences of psychosis. And at the same time, we don't want to collude and encourage it, right? There are ways to kind of, you don't have to agree and say, yep, someone's definitely following you. You just say, wow, you can validate the feeling that might be underneath that. Well, that sounds like that'd be pretty scary or unnerving. It's important to be open to different explanations and experiences. Again, for trying to forget in some ways that you know so much about your young person that is so valuable. And I'm not saying throw it away, because it will help you and it will help your young person. But when you're trying to be curious and trying to show an openness, you might have one way of thinking, but your young person might have a different explanation for their experience or their experience of psychosis. And that doesn't necessarily mean that's wrong or that those have to be completely conflicting. And again, thinking about the relationship, we really want to connect. We want to normalize. You might use some selective personal disclosure. You might have experiences of psychosis that you've had, or if you don't, that's okay. But you might say something like, wow, I'd be scared too. We want to be careful here to not all of a sudden like make something completely about ourselves when a young person's just disclosed maybe about one of their experiences of psychosis and say, oh, you know what, like one time I was super scared of heights or something like that. That might be a little bit off base, and we want to kind of keep the focus on the other person. But we can normalize and connect by saying like, I haven't experienced that myself, but like hearing you talk about that, wow, yeah, I would be really scared too. And that by doing that, you're connecting, you're normalizing, you're not agreeing or colluding with anything that might not be reality based, but you're still kind of fostering that connection with your young person and helping them feel understood and seen. So here are just some examples. I'll go through them quickly, but I wanted them to be available on the slides for reference. Examples of asking curious questions about the experience of hearing voices or anything for this one, first one, but what's that like for you? Tell me more, right? Simple, open-ended questions. And then a bit more specific. Here you're asking permission. If you notice this one, can I ask what it is that you hear? I can't hear the voices myself, but I'd really love to understand. Right? Again, the tone, the curiousness, you're asking permission. What do they say? Are they friendly, scary? Do they ever tell you to do anything? And just like I had shared before, is it okay that I'm asking these questions? I just really want to understand what this experience is like for you, and maybe even if you're still rolling with it and trying to understand, like, how do you make sense of this? Where do you think this is coming from? Again, a lot of these parallel some of the questions that we'll ask and some of the approaches that we take therapeutically as well. And there might be times where you feel this is not a skill that you're ready for yet, or that your young person doesn't want to talk about it or things, and that's okay. But just want you to know that there are ways to be curious, even about kind of intense and potentially scary experiences. So validation, and this is kind of our last kind of big skill. I've already been alluding to it in many ways that I want to talk about. And so if you only take away one thing from today's talk, I hope it's this skill. Helping someone feel seen and understood is so key, and it's just essential for building a strong relationship with your young person. Validation is, like I said, helping someone feel kind of understood, seen, that their experiences make sense to them. It doesn't mean that you're saying that they're real, but that the person's, experiences are valid. Different ways to be validating. Simply paying attention and listening can be validating. So, right, like I said, just sitting with someone, being curious, listening to what they have to say, nodding along, just being present can be validating for someone. It's important to know that, again, feelings are always valid. I've already said this like 3 times, but even if you don't agree with the content, the way that someone feels is valid. It's their experience, it's their right. Whatever they're feeling, even if you wouldn't feel the same thing, it's okay. So you could always say, it makes sense to feel that way, or I can see how you'd feel that way. And try to perspective take, right? Try, if you're really struggling with this and you're like, I can't, like, they're just my young person, my family member, whoever it is, my friend, they're just saying things that are so bizarre and I'm having such a hard time connecting with them about. But try to imagine what it might feel like. For example, if you were convinced that someone was following you, or you were convinced that others could read your mind. Imagine that invasion of privacy. You couldn't even have control of your own thoughts, or, be able to kind of keep those private, right? So to really try to sit and think what that might be like, even if you can't agree with it. And then try to find and identify the emotion from there. Oh, that sounds really difficult. Or that sounds really upsetting. One thing with this, again, I think it's always good to check in how things are being received. So maybe we're trying to validate and get at an underlying emotion, and then your young person's like, no, that's not what it's like. So checking in, like, hey, did I get that right? Is that what it feels like for you? And they might be like, no, it's actually like super exciting that, even though, people reading my mind, I can read other people's minds too, right? Maybe they feel excited about this, feeling that they might have some type of special skill or special power. And so maybe then the reflection there is like, oh, okay, yeah, I didn't understand it that way. So like part of you feels like this is a little scary that other people can read your mind, but exciting and special that you feel like you could read other people's minds. Right? So you're checking in. You don't have to get this perfect. We don't expect you to be, again, trained therapist, but just recognizing that, a lot of this is trial and error. You try to be validating, but again, you've always got that tool in your back pocket of checking in how it's going, and then you can adjust. So as we talked about, using reflections, and there's different types of reflections that we can use. Your most simple reflection is really just paraphrasing back what you heard. I'm hearing you say that you're worried that people are out to get you. Pretty simple. You just hear what the person says. If you were listening, you just kind of repeat it back in slightly different words. The next level that I've been talking about quite a bit, kind of going a level underneath, is trying to get down to the underlying feelings. I imagine that you might feel scared, overwhelmed, hard, that this is hard or confusing. And then a more complex reflection might be, I imagine it might feel stressful to be in public right now. If they're expressing, the feeling that people are out to get them or they're unsafe or being followed. Do you want to go somewhere less crowded for a bit? So there you're kind of making a little bit of a jump to try to guess how someone might be feeling and even making a slight suggestion. All right, so I think this is kind of my last slide about communication strategies. So I want to talk about something that is called the writing reflex. So this is a concept that maybe you don't know the name for, but I bet many people can really resonate with. And so this is the very common impulse that I think all of us often feel to relieve another person's suffering by fixing their problem or pointing out solutions. Your young persons, they're smoking a lot of cannabis and their psychotic symptoms are getting worse, or they're struggling to be motivated, and you just want to jump right in there and say, like, if you would just stop smoking, all of your problems would go away. Or like, if you would just do this, and it doesn't even have to be that like aggressive or accusatory. There's different, more subtle ways that we do it. And I think we all feel inclined to do this, whether this is in relationships with our children, partners, other people in our lives, right? It's a really natural reflex that we have, because it's hard to see the people that we care about struggle. And it's like a reflex because we often do it without even thinking. It's just where our mind goes, like, oh, problem, pain, I want to help. I've got some ideas. I want to make it go away. So what's wrong with that? Sometimes nothing. Okay, sometimes we can throw out some solutions and like they will be received and it's fine. But other times it can feel really invalidating. Like, no, like you're not understanding where I'm coming from. Or like if it's the cannabis thing, like cannabis is so important to me. It's how I like connect with friends or whatever. Cannabis isn't the problem. It can cause a lot of conflict. And this isn't just about substance use, it's about anything. So what can we do about it to kind of stop this writing reflex or keep it in check? The first thing is slow down. Use these other skills that we talked about, okay? Listen, maybe ask curious questions, validate, and then maybe after lots and lots of that, maybe we ask permission. Is it okay if I gave some advice right now or shared my perspective? And they might say no. And then you might have to kind of live with that for that conversation. But again, if we're thinking about some of those key concepts of helping someone feel in control and listened to and heard, and those are things that we all need to kind of make confident decisions. So thinking about those steps, if we find ourselves like in this kind of conflictual pattern with a loved one, is hang on, am I engaging in that writing reflex? And can I turn it off for a little bit, even though it's so well-intentioned? And I've had a lot of parents say like, thanks, Dr. Sykes, for all these tips, asking permission, I'm trying to do it, but what if I just sound so bizarre? What if my young person's like, you're talking so weird now, like, what are you doing? Or like, don't try to be a therapist to me or something like that. So you can even say like, I'm working on being a better listener. I'm testing out some new skills because I want us to communicate better and fight less. Or like, okay, you can even like make light of it. Like, I know I might sound a little weird and awkward right now, and this isn't how I usually talk, but I'm trying something new because I really want to better understand you and I want to communicate better. So bear with me if I sound not like typical mom or things like that. And there's a lot more, there's actually a whole like interactive course. A lot of this work, especially adapted for folks with early psychosis or parenting young adults. Dr. Emily Klein has done a lot of work out of her research lab and conducted a study and made a course for families called Motivational Interviewing for Loved Ones. in summary, remember that families can have a big impact on recovery, right? Just as I've been saying, we want young people to feel like some things are in their control. I want you all to feel like there are some things that are in your control and that you can be empowered to enact these strategies and skills. And they're not always going to work perfectly. We're going to mess up. We're going to lose our cool. We're going to get negative responses at times, but you do have some power to do a lot of things that research shows will help your young person. So remember to focus on your relationship, listen and be curious, try to resist that writing reflex so that we can be validating. So to finish up, I just want to make you aware of some of the existing STEP Learning Collaborative resources. Obviously, you found this talk today. Taking a step back of kind of what we're doing in collaboration with DMIS and DCF, the STEP program has made, the STEP Learning Collaborative. So we've made a network of 20 plus clinical sites across the state with the goal that any individual experiencing early psychosis, no matter what zip code they live in, will be able to access outpatient care rapidly for psychosis. And so criteria for this initiative is between the ages of 16 and 35. Someone experiencing early psychosis must live in Connecticut, must be English speaking, although if you're not, we'll still connect you to care. And this is our unified referral number. So this is one referral number for the whole state. You'll call it. We'll just ask for a little bit of information on a confidential line, and then one of our 5 early detection and assessment coordinators will get in touch with you to see if your young person is eligible and then try to connect them to care if they're willing. And so additional offerings, today's was the Family and Community Workshop. They're available the 3rd Thursday of the month from 12 to 1. So we've got a bunch more lined up for the rest of summer and then hopefully into the fall. We have various virtual resources. So you can check out past talks, tip sheets, some of those downloads that I was talking about, family guidelines, and then ways that we're supporting health providers that are within our network as well as those that aren't. Is we're doing a provider training series, which family members are welcome to attend, just knowing that it's not specifically directed for you. We're offering a free consultation service for providers. So anyone treating someone with psychosis who has a question, whether it be about therapy, medications, other types of support, they can get free consultation. And then, as I mentioned, this was part 1 of our 3-part strategies for carers workshop. So next month, we'll focus on communication tips for common scenarios. So myself and one of my colleagues will actually be role-playing a lot of ways to enact some of these strategies in different situations, such as how to respond to someone who's actively experiencing delusions or paranoia, actively experiencing voices, how to respond in a situation that's kind of escalating into an emergency situation, how to help motivate someone who might be experiencing negative symptoms or not taking medication. So we're going to try to act out and really give you real examples of these common scenarios that we know that family members are facing every day. Talked about the STEP Learning Collaborative website, but you've probably also heard about Mind Map. It's our public awareness and early detection campaign. So we've got different media ads, resources, newsletters, and things across the state that's trying to get the word out about signs and symptoms of psychosis, the importance of treatment, and most of all, kind of getting out this centralized referral number to let folks know that we're trying to connect people to treatment as quickly as possible. That is it for today. Thank you so much.